Hello, everyone. I wanted to welcome you to the Delta Dental presentation for your 2021 open enrollment period. We're very excited to welcome Delta Dental to the IQVIA benefit offerings for this year. And we have our resident expert directly from Delta Dental on the line to go through the new benefit offering with you. So please, we will be keeping all lines muted during the presentation. If you do have questions at any point in time, you can submit them through the chat box, but please keep your lines muted. We will have a time for questions and answers at the end. So if your question is not addressed during the presentation or through the chat box, we will stick around after to make sure that all of your answers or all your questions are answered. So without further ado, I will turn it over to our Delta Dental representative, Rosie.
Thank you so much. Good afternoon, everyone. Thank you so much for having me. We are very excited to partner with IQVIA, and I will be presenting the Delta Dental benefits this afternoon. First, very important, a reminder that a dental election is required if you want dental coverage for yourself or your family for the new plan year. So I'm going to start with the Delta Dental PPO plans. Our Delta Dental within our network have PPO providers and premier providers. Really, it's one network with two levels of savings. On the PPO plan, you are able to go to non-contracted providers, but we strongly encourage you to stay within the networks because that will save you on your out-of-pocket costs. The difference between our PPO providers and our premier providers are the amount that we reimburse them, the amount that we pay them. You will get the most savings with Delta Dental PPO providers. You will also have some savings with the Delta Dental Premier providers, but not as much as you would have with PPO providers. So if you're looking for a new provider, we strongly encourage you, excuse me, to look within the Delta Dental PPO network. That will be your best bet. That's how you're going to save the most on the plan. We're going to start with the base plan. Sorry about that. On the base plan, you're going to have a deductible per plan year of $75 per person if you visit a PPO provider, or $100 per person if you visit a premier or non-contracted provider. The deductible will have to be met by each person that you have on the plan, by yourself and your dependents. Now keep in mind that the deductible is waived for diagnostic and preventative services. On the base plan, you're going to have $1,500 for your annual maximum per plan year, and you're going to have $1,500 as your orthodontic lifetime maximum. On the base plan, diagnostic and preventative care, if you visit a PPO provider, will be covered 100%, so the employee pays 0%. If you visit a premier or a non-contracted provider, you will be responsible for 50%. Again, the deductible does not apply to diagnostic and preventative care. On the base plan, if you have basic services, for example, fillings, simple tooth extractions, you will be responsible for 20% after the deductible. If you visit a PPO provider, you will be responsible for 70% after the deductible if you visit a premier or non-contracted provider. For major services, for example, periodontics, crowns, oral surgery, you will be responsible for 70% after the deductible. If you visit a PPO provider, you will be responsible for 80% after the deductible if you visit a premier or non-contracted provider. The base plan covers orthodontics for children only. When we say children, we mean your dependents through age 26. And orthodontics is covered until the day that your dependent turns 26. Once the dependent turns 26, they have no more coverage for orthodontics. The rest of the benefits are available to your dependents through the end of the calendar year that they turn 26. But as far as orthodontics goes, it's to the day that they turn 26. On the base plan, orthodontics is not covered for adults. And again, the lifetime maximum is $1,500. On the PPO buy-up plan, the deductible per plan year is $50 per person, up to $150 per family. So if you have more than 3 family members on your plan, the 4th and beyond would not be responsible for the deductible. And again, the deductible is waived for diagnostic and preventative services. On the buy-up plan, the annual maximum per plan year is $2,000 per person on the plan, and the orthodontic lifetime maximum is $2,000 per person on the plan. Diagnostic and preventative care, again, is covered at 100% if you visit a PPO network dentist. So the employee is responsible for 0% if they visit a PPO provider. They visit a premier or non-contracted provider, then the member is responsible for 20%. For basic services, again, examples, fillings, simple extractions, root canals, the member is responsible for 20% after the deductible if they visit a PPO provider, for 50% after the deductible if they visit a premier or non-contracted provider. For major services, some examples, crowns, implants, the member is responsible within the PPO network for 50% after the deductible. If they visit a premier or non-contracted provider, they are responsible for 70% after the deductible. A couple of notes, implant coverage is new this year. It is available on the PPO buy-up plan. So that is something to take note of. That's something that you're interested in. Implants are covered at 50% again if you stay within the PPO network, or 70% if you go outside of the PPO network. One other thing I want to point out on the buy-up plan, cleanings, the coverage for cleanings, you get 4 regular cleanings and 2 periodontic cleanings covered under preventative services. On the previous plan, on the core plan, you would receive 2 regular cleanings under the preventative care. Staying with the buy-up plan, orthodontics is covered at 50%, and it is covered for adults and for children. The lifetime maximum under the buy-up plan is $2,000. One tool that we have available if you want to know what your out-of-pocket cost is going to be for certain procedures before you have the work done is a pre-treatment estimate. Your dentist would submit a claim form to us without a date of service so that we know you haven't had the work done yet. You just want to know what your out-of-pocket cost is going to be. We will process the pre-treatment estimate, and we will send information to you and to your provider, letting you know how much Delta Dental will cover and what the patient out-of-pocket responsibility will be. Rachel, did you want to pause here to answer any questions on the PPO, or do you want me to keep going?
I think we can proceed for now. Okay,
great. So I will start talking about the Delta Care plan, which is the DHMO plan. With the current partner that you have, the HMO plan is only available within the state of Florida. With Delta Dental, the Delta Care plan will be extended to the states listed on the screen. So if you or your dependents are within these states, you are able to join the Delta Care plan. The Delta Care plan does not have any annual maximums. There's no deductibles. This plan is based on copays. So depending on the services that you have done, you have a set copay for each procedure. There are no claim forms for the member to fill out. Lower premium plan. Again, no annual maximums, no deductible, just depending on the work you have done, you have copays. On the Delta Care plan, you have 178 more covered procedures that you did with the current partner. Also, all of our copays are all inclusive, so you will not have any copays that have additional fees for lab or for materials. The copays that are listed within the booklet are all inclusive. There are no additional fees aside from the listed copay depending on the procedure you're having done. On this plan, there is coverage for posterior composites fillings. There's no missing tooth exclusion, so even if you don't have a tooth, you can still get work done in that particular space. Implants are covered on the Delta Care plan, and tooth whitening is also covered on the Delta Care plan. So how the Delta Care plan works, you're going to be assigned to a provider. You select the provider. You can change the provider at any time, but you do have to be assigned to a provider with this plan. You will make your appointment, visit your provider, and then pay any corresponding copayment depending on the procedures that you're having done. If you need to see a specialist, your assigned provider will give you a referral to see a specialist within the Delta Care network. Remember, this is an in-network benefit only, so all work must be completed within the network. If you need to see a specialist, your assigned provider will give you a referral to see a specialist. If you should be traveling outside of your coverage area and you have an emergency, you can call our customer service and they will give you information so that you can see any dentist where you're traveling for emergency care. Wanted to point out braces, orthodontics is covered for adults and for children on the Delta Care plan. We cover all phases of orthodontic treatment, pre and post records. Tooth extractions related to orthodontics are also covered under the plan. And we wanted to list some of the more common procedure codes for you so that you could see them. But again, the complete list is available to you on your portal for all the procedures that are covered under the plan. Also wanted to give you some additional information on the teeth whitening and implants. Implants are covered again under the Delta Care plan at copays. Everything is covered with a copay. So we wanted to show you the copays for teeth whitening and for implant services if this is something you're interested in. And again, all the list of complete copays is is available to you on your portal. To find a provider in the Delta Care network, you would go to deltadentalinS.com. And remember, the name of the plan is Delta Care USA. This is the HMO. So if you're looking for a provider for the HMO plan, you want to look under the Delta Care USA network. You can create an account online, but if you're just looking for a provider, you do not have to create an online account if you're just looking for a provider. An important note is if you do not make an election for a provider, when you sign up for the plan, we will automatically assign a provider to you based on your zip code. But again, that can be changed at any time. You do not have to wait for open enrollment to change your provider. I want to review some web and mobile resources. So again, our website is deltadentalinS.com. And this is the website, whether you're on the PPO plan or the Delta Care plan. You can view and print your ID cards. You can look up your claims. See your plan information, and we have some additional tools for pre-planning and budgeting for dental costs, which we'll talk about shortly. We have a mobile app that is very user-friendly, very convenient, and easy to use. If you do use the mobile app, the ID card is right on the home screen. So again, it is very popular with our members. I encourage you to download that. You'll have your ID card right with you on your phone at all times. And again, it is very convenient and easy to use. Again, to find a provider in our networks, deltadentalinS.com. Again, if you're in the PPO plan and you're looking for a new provider, I strongly encourage you to look within the PPO network. That's where you're going to get the most savings. You just click on the tab that says Find a Dentist. You can enter the address information. And we also have Yelp reviews on our website so that you can see what other people that have visited that provider have rated them. So another tool that we have for budgeting purposes is our cost estimator tool. And this is a great tool if you're on the PPO plan. It's going to give you an estimate, a very good estimate of what your out-of-pocket cost is going to be. And it will allow you to compare cost with different providers. So you can put in different provider offices and it will tell you what your out-of-pocket cost would be for a procedure at each office. This tool is going to recognize your plan. It will know what your coverage is. It will know if you've met your deductible. It will know if you how much of your maximum is left. So again, it's going to give you a very good estimate of what your out-of-pocket cost is going to be. And it will also allow you to compare in-network providers to out-of-network providers so that you can see what your out-of-pocket cost difference is depending on which provider you go to. A couple of value-added services I wanted to share with you. We offer discounts on hearing aids and LASIK surgery. Our partner for the hearing aids is Amplifon Hearing Healthcare, and the average savings is 2% on hearing aids. For LASIK surgery, we partner with QualSight, 40 to 50% off traditional LASIK eye surgery fees nationally. There's more information on your portal on both of these programs, and these two programs are available to yourself and anyone in your household, not only the dependents on the plan, but anyone within your household. And that is the end of the presentation. If you have questions that I can answer, Rachel.
Yes, I have a few of them. Can you quickly cover how Invisalign would be treated in place of an orthodontic, as part of the orthodontic benefits?
Sure. So on the PPO plan, Invisalign can be used. It's going to cost a little bit more for the member only because Invisalign is a little bit more expensive, but you can definitely use your lifetime maximum for Invisalign. It's not currently covered under the Delta Care plan. On the Delta Care plan, it's traditional braces.
Thank you. And can you review where they can locate the cost estimator again? And are they able to do that before selecting a plan?
So they are not able to do it before selecting a plan. Once you are effective on the plan and you create a username and password, when you log on, there will be a link that says estimate your costs, and you click there, and from there you go, and it will give you the tool there.
And can you just relay for the group the main differences between the DHMO, the Delta Dental USA DHMO, and the PPO, why someone might go one way or the other?
So on the PPO plan, you have more freedom of choice with dentists. So the networks are larger. There are more providers within the networks to elect, and you can also go to a non-contracted provider. Although we don't encourage that, but if you've been with a dentist for a very long time and they happen to be non-contracted, you can still visit that provider. On the Delta Care plan, it's an in-network benefit only. So if your provider does not participate within the Delta Care network, you would not be able to use that plan with your provider. Another thing to take into account on the PPO plans, there is an annual maximum, plan year maximum, whereas on the Delta Care plan, there's no maximum. So if you have a lot of work that you have to have done, you might want to consider the Delta Care plan. However, keeping in mind that you have to stay within that network. If you're interested in implants, for example, you might want to consider either the buy-up plan on the PPO, because that's the one that covers implants, or the Delta Care plan that also covers implants. Those would be some of the major differences.
Thank you, Rosie. And then another question came in about skin grafting for recessed gums. Do you know how this would be covered under the PPO plans?
No, off the top of my head, I wouldn't know that. I would need a code to be able to look that up.
Okay. All of the brochures are attached in the enrollment portal at icubabenefits.org. So as you're stepping through the enrollment on the dental selection page, there is a PDF link to the 3 different plan summaries. That's where you can view those preset copays for the DHMO, and also you have access to the plan comparisons for the 2 PPO plans. IQUBA is offering 3 new plans this year through Delta Dental: a base PPO plan, a buy-up PPO plan, and that Delta Care USA DHMO plan. Quickly, Rosie, can you talk about like an orthodontic takeover and how that process will work for both of the plans?
Sure. So on the PPO plan, if you or your child are in the process of orthodontics, you just need to let your provider know after 4/1 that you now have Delta Dental, and they will send us the information required for us to continue with your care. So we're gonna pick up, I'm sorry, where your current carrier left off, and we will continue until we finalize your treatment up to your lifetime maximum again. On the Delta Care plan, there is a small form that your provider needs to complete and send in to us. And the form is also available on your portal. And again, with the Delta Care plan also, we're gonna pick up where your current carrier left off. So you don't have to worry that, you know, any payments are gonna be missed or that there's gonna be any portion that you're gonna be responsible for. And on the Delta Care plan, if the current provider that you're using is not within our networks, it doesn't matter. We will still work with that provider and continue to make the payments so that you're not affected by the transition to Delta Dental.
Thank you. And then can you quickly just review the vision and hearing aid bonus benefits that they get through the partnership with Delta Dental?
Sure. So it's a discount plan for both. I believe you have the information on the portal. There's a website for each and a phone number that the member can call, and they will know that you're calling from Delta Dental, and they will work with you to set up an appointment for you to be seen for the hearing aids or the LASIK surgery.
And this information is currently not on the portal, but Rosie, I will collect these like flyers from you, and we can have that uploaded to each of the libraries at icubabenefits.org.
Okay, perfect. Sounds good.
In the IQUBA benefits enrollment, you are requested to pre-select your DHMO provider. It is the facility ID number that's available at deltadentalins.com. That process can take place directly in the portal, and you have a section where you can include that facility ID before you close out your enrollment. If you do not select a DHMO provider for the Delta Care USA plan before you submit your enrollment, that Delta Care dentist will be assigned to you based on your zip code. So Delta Dental will be collecting the facility IDs that are keyed during the enrollment, and anybody without a facility ID will be automatically assigned. That does not mean that you're stuck with that dentist for the duration of the year. Members can call at any time and change your primary care dentist. That dentist change must be made by the 15th of each month in order to seek treatment for the first of the following month. So at any given time in your course of treatment, you do have to go to the assigned dentist, but you can just keep in mind that that dentist can always be changed as long as it's by the 15th of the month for the following month. And there is no additional cost for the hearing aid benefit or the QualSight benefit shown on the screen. These are automatically paired with your Delta Dental election. Are there any other open questions that either IQUBA or Delta Dental can answer for you? Rosie, do you know if which plan would be best if for somebody that's interested in choosing Invisalign?
So if for a child, either of the PPO plans, for an adult, the buy-up plan, because there's no coverage for adults on the base plan.
If a dependent is already in orthodontic treatment and the benefit has already paid out the lifetime maximum, but once the lifetime maximum is met, there will be no more benefits paid out. So if your lifetime maximum for orthodontics was met under the prior plan, then there will not be an orthodontic maximum under the Delta Dental plan. The buy-up plan does offer $500 additional coverage towards the orthodontic benefit. The base plan covers $1,500 lifetime maximum, and the buy-up plan covers $2,000 lifetime maximum. You are able to change your primary care dentist online, I believe, but IQVIA members will not have access to the Delta Dental online portal until after the effective date of April 1st. We are working to get Delta the file of participants as soon as possible. We are hoping to send that file over in early March. So you may be able to call between March 10th and March 15th if you would like to request a primary care dentist. But just in case that does not happen, I would encourage you to make your facility ID selection in the portal during the open enrollment period. And then just keep in mind that you may need to either visit the dentist that was pre-selected for you if you do not make that assignment, or wait until May to seek treatment so you can call and make that update to your PCD. Again, you can visit deltadentalinS.com, and they have the Find a Doctor search tool on their website. For the PPO plans, you'll be searching for Delta Dental PPO. That will save you the most money. There's also, for the PPO plans, the Premier Network, which is still considered in-network, but just has a slightly larger out-of-pocket for the members. And then for the Delta Care DHMO plan, you'll select Delta Care USA as the network provider. And Rosie, the benefits shown on the screen are paired with all three of the dental plans, correct?
Yes, correct.
The two PPO plans are nationwide plans, and then the DHMO plan is only available in the states provided earlier in the presentation, and the states are also listed in the enrollment portal. On the page where you're making that DHMO selection, all the states are also included there as well. The buy-up plan is called the Delta Dental buy-up plan. Unfortunately, there is not a representative that IQVIA members have access to just yet, because if any one of us was to call Delta Dental today, they would not know who we are, and our plans are not in effect until 4/1. But if you have any outstanding questions after this presentation that were not answered, or any questions that come up later today, I would encourage you to double check the PDF benefit summaries that are included in the portal. And if you still have questions that are coming about, you can always email us at benefitsadministration@icuba.org, or reach out to your HR benefits department, and they can always get the questions to the IQVIA management team as well. If your provider has both Delta Dental PPO and Premier Networks listed, it will be the IQVIA benefit will pay in line with the in-network benefits. There is a question in the chat that I'm not quite understanding about paying for the premium option. So if you'd like to rephrase that question, I'd be happy to try to answer it for you. Any other questions? All right, well, we will stick around for a few more minutes if you have any other questions. If not, thank you very much for joining. We hope this information session was valuable to you, and happy enrolling.
Hello, my name is Emil. I can, unfortunately. Hello. Hi, my name.
Hi. I don't know if anyone can hear me. My name's Meredith. I was the one who was asking the question.
Can we please use the chat box, please? Rosie, can you cover Invisalign one more time and how it's covered under the plans?
Sure. So Invisalign will be covered under the PPO plans. So for adults and children, it's covered under both plans. For adults, it would only be covered under the BIA plan. The Delta Care plan would not cover Invisalign.
If your dentist on Delta Dental INS is part of the Premier Dental, the Premier Network, that is considered an in-network provider. Just the reimbursement from Delta Dental will be a little bit lower, and the member, your responsibility will be a tiny bit more. I would encourage you to review the summaries that are included in the portal and just check out how the Premier Network reimbursements are, because the employee portion that you would pay is a little bit higher with the Premier Network than with the Delta Dental PPO. The good thing is they are still part of the network and they do still have the negotiated discounts and contracted rates. So with the Premier Network and fully in network, there's not the risk of the dentist balance billing you like if you were to go out of network. The dental ID that you'll need for the DHMO plan is the facility ID. And this on the portal is listed right underneath the provider name, like the location name. And it's on my computer is in green text with an underline. The buy-up plan does have orthodontics covered up to $2,000. The base plan has orthodontics covered up to $1,500. So if you currently have ortho coverage up to the lifetime maximum of $2,000, that would be the buy-up option with Delta Dental. During the enrollment process, the DHMO provider is after you submit your benefits and right before you would select your beneficiaries. So you actually complete all of your benefit elections and hit submit, and the very following page is where you can select your DHMO and enter the facility ID. We will have a recorded session available, a link, and each school also has recorded sessions available by each institution. But this live session was recorded, and we will also have this link available shortly. If you previously had orthodontic benefit and you used the benefits under Humana or a private carrier, unfortunately, it is a lifetime maximum, and those lifetime maximums will be carried forward, so that will not refresh with Delta Dental. Are there any other questions? All right, well, with that, we will go ahead and close the session. Thank you very much, Rosie, for your time and participation. And again, thank you very much for all the participants who joined. And we hope that you go in and make your elections before the end of open enrollment. Have a good one. Bye.
Thank you.